Welcome to today's webinar with eLotus, the leading provider of acupuncture continuing education. My name is Donna Chow, and I will be your host and your moderator for today's class. But first, exciting news. We have a brand new addition to the core section of our website. Check out LCH Auricular section dedicated to the renowned auricular medicine doctor, Dr. Li Cheng Huang, hence LCH Auricular section. Discover how Dr. Huang effectively treats various ailments using only the ears. Just click on Core at the top of the webpage and explore this new section. We'd love to hear your thoughts. Today's class is TCM Strategies for Elderly Health, CHF, Sinus Issues, and Dementia, and sponsored by Evergreen Herbs, and will be presented by Roberta Jean Leong, who has been teaching with eLotus since 2016. To browse her video courses on treating lupus, Lyme, or severe infections, visit us online at elotus.org. All right, so before we dive into today's class, let's ensure an engaging and informative session. Please set your chat preference to everyone in the chat room so that all attendees can see your messages and participate in the conversation. If you have any questions for Jean, please type them into the Q&A box. And remember, after the webinar, there will be a quiz available the following workday, and we'll notify you by email once it's ready. Today's class will run from 8 a.m. to 5 p.m. Pacific time, and we'll have 4 breaks throughout the day, and lunch scheduled from 1 to 2 p.m. 12 to 1 p.m. Sorry about that. So lunch again, 12 to 1 p.m. All right, so our speaker today is Roberta Jean Leong, a highly experienced clinician, author, and instructor. She's been a licensed acupuncturist in California since 1985 and has had the privilege of observing the legendary clinician Miriam Lee's practice during her early years. Jean's extensive knowledge and background makes her an excellent resource for this topic. All right, so without further ado, let's welcome Jean Leong. Jean, please feel free to share your presentation now.
I became interested in using Chinese medicine to help heart disease because people in my family were not doing well. And I didn't get any requests to help them, but I saw people in their 40s, 50s having very severe problems. And I thought, well, I have some of those genes, so I don't think I want to wind up with these problems. What can I do to help them if they ask me? And what can I do to make sure that I don't have these problems early in life? Somebody in my family was out for a bike ride. He was in his 40s. He had a heart attack, dropped dead on the trail, and by the time help got to him, there was no hope. So what I was thinking after that is I need to learn everything I can that is basic from Western medicine and see what there is in the texts that I have for herb medicine and try to remember the way that my mentor would have treated people. And at the time, this was all very new to me. I didn't start doing acupuncture thinking that, oh, well, I want to try to treat heart disease. That's not what happened. It was more a matter of, oh my God, these people are dropping dead. Is this going to happen to me? Can I do anything to make sure that if somebody does ask me, I know how to help them? And so I started reading about this stuff from all kinds of different points of view. And I did read about a lot of the heart treatments in herb books. And some of these texts have names of formulas that don't 100% match what's easy to buy. meaning that, there are some formulas with a specific name and you go and you buy the pill or something like that from one of the suppliers. It's not always exactly 100% the same thing in these old books. And then I also found an old handwritten notebook in my family from someone who had learned to do herb medicine. And I can't read the whole thing, but again, the same thing happened. So I just thought, well, I really better understand the properties of each of these herbs and what the whole concept is. And I have treated a few people now with Chinese medicine, and they are generally helped with acupuncture and Chinese herbal medicine. And they have to have a better diet. They have to have better exercise. So I really think some of these very serious diseases can be totally helped with Chinese medicine. I don't think people have to have Western medicine only or Western medicine at all in some cases. And I think people can recover. All right. So cardiovascular disease is what usually starts everything, and then people can have congestive heart failure. So CVD is the short word or term or acronym for cardiovascular disease. CHF is congestive heart failure. And in the United States, many people in their 60s and over have a lot of heart trouble in one form or another. I mean, there's an enormous amount of people who are constantly taking medication for hypertension, and their doctors are probably doing the right thing by helping them lower their blood pressure that way, but they don't usually try to look for the root cause and help them with that. And so at this point, I'm happy to say that my family history hasn't caught up to me in that way. And I think that all the information that's out there means that we can all find something to help us, help ourselves, and help our patients. I went to the library, I read things online, and I'm always looking every month or two at what new research there is, because both Western medicine and Chinese style testing, like herb formulas are being tested to see if they really do or don't help. Individual herbs are being tested to see if they really do or don't have a particular effect. And in the United States, research has been going on since data was collected. And then after this data was collected, there's a lot of information that they were able to examine. And one of them is the Framingham Heart Studies. And there's a website. So I've posted it here because if you want more information, there is quite a bit of information available. And then in the US, there's 2 websites, and they get updated every now and then. And the information is not static, because just like the Framingham studies, as there's more information, they are able to provide additional details. The 1948 year marked the start of data collection. And before that, everything was sort of just word of mouth, but they started looking at the cause of heart problems. And there were thousands of people included. And to start this research, they just collected data. They didn't do anything else. They just collected data. And this study went on for a long time. And then all of the descendants of the original participants became part of the study, and now it's on to a third generation. There's information posted now on their webpage, and I've looked at it all. Sometimes I look at some of these Western data sets and I think, oh, that doesn't really sound right, or I don't agree with it, but there's so much data there, and I think all their analysis makes sense. And one of the things that happened is they started including different types of people. And a lot of correlations were found. Interestingly enough, most of the data that was first collected focused a lot on men, not women. Now that's all changed. When they sorted out the data, there were a lot of things that they found, and two things in particular became red flags. So they found correlations. That is, people who had died of heart disease or had a serious heart health event almost always had a couple of problems. And when I talk about correlation, that's not the same thing as the cause of something. I have a typo here. It says in the study, red flags are identified. Anyway, there are useful to know these things. And even though it's kind of out of our scope of practice as Chinese medicine practitioners and clinicians, at one point I had people who would always bring in their labs to me and show them to me. And I would never order labs. I generally just looked at stuff that people hand to me. For this study, not all the causes are understood still. Two really big things showed up, and so doctors, primary care providers, general practitioners always pay attention to these things. One of them is if someone is having high blood pressure. Now, as people age, their circulation changes. So when they are younger, they tend not to have so much plaque or problems in circulation, but almost all of us, as we get older, there's going to be a higher blood pressure for the body to function normally. So for seniors, meaning middle age and older, or maybe certainly by 60 or 65, if somebody has blood pressure of maybe 135 over 85, that might be just fine. And if somebody's 30 years old with that blood pressure, it's probably not okay. And the reason is, as the arteries and circulation gets a little more constricted or obstructed, or the arteries start to harden, then a little more blood pressure is normal for blood to get everywhere in the body, especially to the brain. And I've seen people who are in their 70s who have high blood pressure, or 80s and they have high blood pressure, but when their doctor gives them medication, they're trying to bring the blood pressure down to 110 or 105, and these people will stand up from a chair and they'll faint, and we don't want that. So you have to pay attention to the age and decide if you're going to take blood pressure in your office as a clinician or you're not. And if you do take the blood pressure and they have high blood pressure, if they don't have Western medication, then it's a good idea to treat them, but also ask if they have a primary care provider, and they should have a discussion with their Western doctor if they're on medication. The other big red flag is high cholesterol. And the same thing happened to me about the lab test coming in. Is I did not make it a practice to order blood tests. What I wanted to do is use Chinese medicine, but people were starting to bring in these lab tests to me. I mean, quite a lot. And some of these people had really high cholesterol and would say things to me like, well, I think I want this kind of medicine, not that kind of medicine. Can you help me get off of my medication for high cholesterol? I said, well, I can, but I don't want you to go off it immediately. It might fluctuate wildly. And I think that's really the scope of practice for your doctor. And you have to be careful because if you do both the Chinese medicine and you have acupuncture and herbs, and things start to move around a lot, you don't want to have your blood pressure dropping too much too fast, and you don't want your cholesterol to crash. And the typical response I would get is, well, I thought that very low cholesterol is better, but cholesterol is a precursor molecule. And so people get cholesterol from food, and their body makes some cholesterol and it goes into the skin. And when people go into the sun, then it gets converted to other things that the body needs. One example is vitamin D. So because we have so much vitamin D deficiency in our country, I think it's mainly because people aren't having a great balance of outdoor activity where they get a little sunshine. There's some information online about this, and there are people who want to have, oh, my cholesterol's at 260, I want to get it down to 80. I don't know that that's a great thing to do. Maybe their doctor says that, but I don't really think that's the best idea. I think there are healthy people with cholesterol that isn't high, and that they're going to be healthier if they have some cholesterol in their system. Okay. After the study, this big study, got all these correlations sorted out, these two conditions were pretty severe, and they decided, well, we're going to have a better result if people drop their cholesterol and they drop their blood pressure. And so now we have a lot of medication to help people bring down the cholesterol and bring down their blood pressure. This worked well enough so that these kinds of treatments started around 1960 something. And in the 70s, more things were developed and a lot of patients started getting them. Now I think it's very common that if there's high blood pressure, if there's high cholesterol, that the normal thing is the doctors automatically try to get their patients on this stuff because it does lower the heart attacks, as we say, catastrophic heart failure events. It keeps people from dying early. And I think for a few decades, these medications just seemed like wonder drugs, and they were helping the population to have fewer heart attacks at early ages. But the data shows now that in 2017, it was still helping people, but the rate of change didn't continue, meaning that the percentage of people that were being helped was flattening out. So you had this decline, but then it was plateauing. And there was no significant improvement, even though people were on the medications. The other thing that the study found is that lifestyle has something to do with these heart health problems. Smoking is really horrible, and people have congestive heart failure and cardiovascular disease at a much higher rate. And if people don't stop smoking, these heart problems remain serious health issues, and they tend to get worse. Hypertension and high lipid panels and smoking are definitely known to be risk factors. Everybody thinks that smoking is a direct cause, but we're not sure why hypertension and high lipid panels are such a highly correlated factor. But we know for sure that smoking hurts the system in many ways. When we talk about heart health, lifestyle has something to do with it. And there are a lot of people who don't exercise. I know people who have told me, oh, well, I was busy working and my doctor never talked to me about exercise until I was about 60. And to me, this is a great shock. And then there are other people who are very overweight, and a lot of them have told me that they don't exercise and they eat too much because it's a way of coping. So they're inherently depressed or having some kind of problems with their life. I think there are people who drink to try to relieve their stress. So I think alcoholism or excessive drinking hurts the whole system. And I think a lot of people don't know how to have a healthy diet. Even people who want to may not know how. So I wanted to find what the Chinese medicine ideas for long life were. And I found a couple of whole books that talked about how acupuncture and herb medicine help, and also lifestyle choices are going to improve people's opportunity to have a long life. And exercise and diet is always included, but it's not exactly the same as what's in the Western medicine approach of trying to improve somebody's diet. So for cardiovascular disease, there are a couple of herbs that appear when you look at the formulas when you are treating people who have qi and yang deficiency that are very severe, and the system is depleted of energy and lacks heat. So you'll find these in a lot of the formulas, but if you have a patient that you're sure has a serious cardiovascular disease problem, you don't want to use any of the formulas that have this aconite herb for too long. And it should only be used when you take the pulse and it's very weak, meaning that when I take the pulse of a patient who needs this kind of treatment, it's sometimes close to imperceptible. And if you listen to the heart, you can tell the heart is beating, but it's lacking in normal energy. So we'll go over some of the formulas that help the kind of patient I'm talking about. The people who really have these cold and yang deficiency problems will have cold spots in their bodies, or their hands and arms will be cold, or something in their body will be cold. And also the other symptoms will show up where, if you look at the tongue and the pulse, you're going to find that there's a pale tongue and the pulse is not rapid. And when the cold is permeating the system, it will eventually deplete the spleen, and it gets so deficient that people will get diarrhea. So this is Zhen Wu Tang. It is a formula that you want to give to somebody who has this type of cold problem, yang deficiency problem, where it's affected the heart channel and the middle jiao. If there's heat of any kind, whether it's true heat or it is yin deficiency heat, this is not to be given. It'll just exacerbate the heat problems and then make it more complicated to treat the patient. So, Tong Mai Zhen Wu Tang. The translation of the words, they describe this as unblocking the pulses and invigorating the circulation. And they're talking about blood circulation here. This is where there's some lack of circulation that is so severe that you're going to find the tongue is not pink. It's usually got a spot, or the whole thing looks sort of purplish. And when you touch the pulse, it's hard to feel. I mean, this is again due to the heart being weak and the system not having enough energy. And the hands or the feet or both will be cold. The arms and the legs will be colder than the torso. This next formula uses ginseng. And these people with this problem are thoroughly deficient. They move around just a little bit and they're panting because they're short of breath. They can't stand to have a change of temperature, to be a little bit cold. If they're living by themselves or in a room where they have control of the temperature, they have the heat on. And in the summertime, they go outside, they still have to put on a sweater. So this is a type of deficiency. And it's very common to see congestive heart failure. So congestive heart failure means that the circulation is so bad that the whole system kind of is not able to be normal, because the heart hasn't failed, but it's weak, and maybe there are arrhythmias or heart palpitations. And this is where someone's got really a problem that can result in edema. This formula doesn't address edema necessarily, but it's from the etiology where you have to help the young, and the chi cannot be restored until the young is not collapsing. It's sinking and it has a deficient quality. Zhen Wu Tang. So this is true Warrior soup. It's a very hot formula, and by this time the kidney and spleen are depleted. So if the kidney, yang, and qi are depleted, there's going to be insufficient urination. You might see edema, and if the yang and qi is depleted from the spleen, there's going to be diarrhea. And if all three of these are depleted, you're going to see some cognitive impact. They're going to have impaired memory, or something is not right. So if someone uses their mind for their job, they're not going to be able to do their job. Like, if somebody isn't doing that kind of work, it won't affect them as much, but they're going to be fatigued and tired. Yet when they lay down at night to go to sleep, they're either not going to sleep well or they keep waking up. And if you have all three channels being affected, it's not as severe as when the pulse is imperceptible, but these people are still very unwell. This is the ingredients list. So it's a formula that can be modified, and if you're sure that your diagnosis is correct and you know this person is having partial or has just had heart failure, this is a list of the herbs to add to this formula. And if it's some palpitations or arrhythmia, then you add the guaizhi, the cinnamon. If it's the arrhythmia plus edema, then you use the Zhen Wu Tang formula and add two things. So that's what this list is. So I'm going to go back one page here, one slide. 2 slides. Okay, so this is the base formula. And then if you have heart failure, you add this, but not everybody who has this problem has heart failure. So then this is the other modification. So this slide shows 2 modifications. This is another yang and qi deficiency type formula, and it doesn't have the aconite in it. It's for a person that has bad pulses, poor, weak pulses, meaning that if you touch the pulses in the wrist, but also, like at a couple different areas, the pulse just feels weak. And you're going to see this with patients probably who have already been diagnosed as having heart trouble. And they're not going to be able to walk well because they get tired. And if you see somebody who gets short of breath very quickly and complains of their heart rate, their heartbeat being not regular, this is a formula to consider. So it's a hot formula, but it's not as hot, and it's not as much of an emergency if a patient needs this kind of formula. It's a much more chi level problem that helps to get the heart more normal and move the blood. The prior formulas are all more kind of like emergency formulas when people are having this yang collapse, so that when you feel the pulse, it feels like the whole system's going to fail soon. I'm not saying these people can't die from heart failure. They typically have congestive heart failure already, but it's not as severe as when the yang and the qi both have totally collapsed. So mai men dong, that herb helps when the system is too dry and the yin deficiency is affecting the person's sleep. So the formula has, if you look in any of the books, you're going to find different amounts of the ginseng listed and a range of how much to put in. But you can take like the normal range at the high end of the ginseng and then double it, just that one herb, if the pulse feels like it's about to become too weak, if it's weak but becoming imperceptible. You don't want to increase that herb, and you want to use just a moderate amount of it for somebody where the pulse is weak but not so faint that you're concerned it's going to become barely perceptible. So I felt the pulse of people with very serious problems, and when they first start having heart disease, usually there's an irregular heartbeat. As they start to have more serious problems, then the pulse becomes faint, and then after that it becomes hard to find. Like the wrist points where you take the pulse, all of the pulses, both surface and deep, start to become hard to feel. And when you find a patient that has a pulse that's almost imperceptible, I really think that they can still be helped if they can take herbs and they can tolerate acupuncture, but they're really in trouble. A lot of those people, I don't think they're going to make it. They're not going to be able to be resilient. And so everything else will become important at that point, like how much they want to live. Everything else kind of hangs in the balance at that point. Anyway, so you want to increase the amount of the ginseng when the pulse is faint, but it's not yet become imperceptible. And if you have a faint pulse, but it doesn't feel like it's headed towards becoming imperceptible, you'll probably feel a pulse that's weak, but it's irregular. And that's when they complain of having persistent palpitations. So the typical formula is cinnamon and guaizhi and longu and muli. So cinnamon, fossilbone, and the oyster shell. Some of these people will improve, but then they complain of having insomnia. That is, they're tired, they go to bed at night and they try to sleep, but they wake up over and over again, or they can't fall asleep. Any type of insomnia with a faint pulse and a regular pulse, and they're complaining of this problem where they have insomnia, poor sleep, palpitations, then all of these herbs in this list are good to add to the formula. It's very difficult once they reach this point, because if they can't sleep well, they're not going to improve. I mean, they're weak, they're tired, and what they want to do is sleep, but their system is so out of balance, they cannot stay asleep and get to the level of sleep where the healing can be thorough. So remember, when you do your diagnosis, all those above formulas are appropriate, but you have to make sure these patients don't have heat symptoms. If you find heat symptoms and you give them any one of those formulas, there's going to be new problems. I haven't seen a lot of total yang depletion. It happens at the end of life a lot, but I think having these very qi deficient and yang deficient systems, these patients get that way from sometimes overworking. But other countries, you're going to see it a lot more where you're not in a first world country and people don't have good living conditions. They're starving a lot or malnourished. They might be living in some kind of environment that's got inadequate shelter, especially in the winter. They might not have enough clothing. In the United States, I think, being a first world country, you're not going to see yang and qi collapse from those same problems. I think it's more when people are either at the end of life naturally through old age, or they've had some set of prolonged efforts that cause them to deplete their system. And this will not have happened all at once. It's very rare that somebody will have this problem for no reason all at once. It's usually because something has depleted their system, and it's usually through some kind of effort that's long and sustained. So it can be from something that could be work-related or family-related, where they're having to have prolonged exertions. So people complain of palpitations and arrhythmias, and they don't feel well because since the heart isn't having normal pumping action, the system doesn't get enough oxygen and blood, doesn't get enough qi. And a lot of these people are told in Western medicine they have to have surgery and have a pacemaker. If they don't get a pacemaker, they're going to have a poor quality of life. But I don't think pacemaker is the only answer. I think Chinese medicine can be tremendously helpful. When this problem has been going on for a while, they're going to have blood stasis. And I've seen this, but I don't think most people that you see typically have this problem. It's the first step, I think, to show that there's a heart problem that hasn't been totally addressed. I think it's usually that the pumping action of the heart is weak, so the body is going to route the blood to areas that it is finding more critical to get the blood and the qi. When you do see somebody like this, the tongue is going to either have purple spots or it's going to be all purple. And as it tends to affect the whole body, eventually, if there's some purple spots, it will just start to get worse if the person doesn't get well. You can feel the pulse. It will be irregular. And if you look at the tongue, if your treatment is working, the purple spots should go away or the tongue might become more normal in color. So then the big question is something like this, if you do acupuncture, can it help people with this type of blood stasis? I think it can. I've certainly been able to help people, but I think that if you see something this severe, they need more than just acupuncture. Maybe they need herbs. Maybe they need to get to the root of the problem. And I don't know if you've seen this type of problem before, but when you have blood stasis that comes on from new stress, people just look wrong. Like you might find a couple spots on their body, but it'll look like a bruise. And if you ask them, they didn't have like an impact or an injury or any kind of trauma. And it just doesn't look right. And it's very pronounced. It's really purple. It's purple like a bruise, a dark color. And sometimes it's bluish. It's very not normal looking. Let's see if I can show this color. This has a lot of blue in it, but I'm talking about this kind of purple. These purple spots on the body, when I first saw these, I just thought, well, that just doesn't look right. Anyway, it's from blood stasis. I think that the best acupuncture for this is to use these points on the list here. This is what I've done. And I've had good results with it. People typically need the stomach 36 point because they usually don't get into that position and condition unless they're deficient. So when I needle, I usually will pick 3 or 4 points and needle them bilaterally. So it's a total of either 6 or 8 points. That's typically what I like to do. This soup, it's a decoction that can be made when you see this blood stasis problem. The honghua, the carthamus, I think is a very powerful herb in this formula. And then in this list, it says danguai, but it should probably be best as danguai wei, meaning the end part, the tail part, because it's more powerful for breaking blood stasis than the tonic, which is just the danguai. Let's see. And I have a typo here. Sorry about that. Ligusticum, Chuan Sheng. That one's very powerful for breaking up stasis. And you're tonifying with a couple of these herbs, but also it's mainly to break up blood stasis. So this kind of mixture can also be given to people who have been injured. But the reason I have it here is because it helps people with this kind of congestive heart failure problem and cardiovascular disease that has progressed to the point where people are getting blood stasis in their bodies. They have in this formula, they also include the zhike, the RNTI, and that one is to help move the chi. But when you have somebody that has this problem that's this severe and you see these purple spots, you want to give herbs that mostly move the blood so that it helps the blood, but you have to give something also that tonifies the blood a little bit, not the majority of the the formula, and you have to give just a little something for preventing chi stagnation. So when I first started practicing, we would have a pharmacy that would run out of certain herbs, and it wasn't so this is a long time ago, and it wasn't as easy to get everything restocked, and sometimes we would run out of herbs. But for example, this herb, you want to have the majority of the ingredients to be moving the blood, but you also want to have something, maybe one thing in there to move the chi, so a carminative type herb, and you want to have something to tonify the blood, because if you're moving the blood in somebody who's deficient, and they're deficient to the point where they have this blood stagnation, they're probably going to be feeling really exhausted. So when you have that much blood stasis, they're going to need something that tonifies. So when this formula, I've looked in a couple of different sources, and it always says Dangguai, but I think Dangguai, the tail, is also appropriate. Okay. Sometimes these people will complain mostly of heart palpitations, and they're very deficient, and they also have yin deficiency. Now, when you have these kinds of patients, just walking in from the door into your treatment room or getting up from the waiting room, when they get up and they walk 30 steps to move through your office, they're so unwell that they're going to be panting and having shortness of breath by the time they move from one room to the other, or by the time they get from their car and get to your reception desk. It's a severe condition. So Codonopsis, astragalus, cinnamon. So Dangshan and Huangqi and Guaizhi, these all will help, but you don't want to keep some of these herbs in there. Chai Hu and Zhika need to be removed from the formula if you have somebody where you diagnose them with both. If they have cardiovascular disease with blood stasis, and you decided they're very qi deficient and are yin deficient also. Sometimes it's more blood deficiency than qi deficiency. So these are the changes to this formula when you have a patient like this. These patients always have problems sleeping. Insomnia is always one of the problems these people experience. And it's very important that they start to sleep well. So if you use this formula and they don't improve, ask them about their sleep. They should improve with this, but ask them about how their sleep habit is, how long they sleep, when they sleep. It's hard if somebody with this problem doesn't sleep well. So sometimes the pulse will be very irregular, and they'll not be able to have any normal activity, and they can't sustain any kind of activity. It's even hard for them to have clarity of thought, because when you have blood stasis like this and there's yin deficiency also, their system just really gets out of whack and they can't function normally. So they're probably not at risk for having a heart attack and dying in the next day or two, but they are really very sick and they need help. And so here are the modifications for this one. And again, if they have insomnia, you can also modify this formula and add maybe swanzalerin or something to help them sleep better. Sometimes you'll find this condition with a lot of symptoms showing that the kidney channel is depleted and deficient. For the people who have this problem. They need both kidney yang and kidney yin tonified. So this last two herbs in the list will do that without creating new imbalances. So this is one of the problems. If you give a patient like this some ginseng, it's going to be too hot because they have yin deficiency, and then their sleep problem will become worse. So if you use something that's not so hot but enters the kidney channel, it will help them more. I think this is a pretty good formula. Yin Shu heat doesn't happen instantly. This can happen from hormone imbalances from the Western point of view. But when I've seen patients, they always describe some kind of life issue that's made them worried, stressed. They start working long hours, or they're obsessing about something. So it's related to some kind of unpleasant situation, or they can't stand their coworkers, or they have some family problem where they have arguments all the time, or something where it's very, very difficult, high stress, and they don't feel like they can stop having emotional roller coaster rides. And when that happens, then the yin is consumed, and usually there's some liver flare, some heat, some stagnation. And this formula is very good when you have the blood stasis with both the yin deficiency, heat, and you see all these purple spots. So you also get those people who will discuss their anxiety. I mean, they'll volunteer it. And then if they want to talk about that, you can do the herbs, but I think it's important to have a dialogue and say something like, well, is there something you can do so that you don't have this big problem with anxiety, stress, and see if they do anything to help themselves, because they probably need to do self-care for themselves somehow.